This is a section of HPV diagnostics, which is primarily performed for the purpose of cervical cancer screening, a disease that affects women. It is one of the cancers that is highly preventable. Using these instruments in the laboratory, automated systems capable of detecting HPV using PCR or other molecular methods, we contribute to cervical cancer screening. If we detect on these instruments that a woman is positive for one of the high-risk HPV types, she needs to undergo further examination to rule out the presence of a severe lesion on the cervix. This virus is very common in the population, and a large proportion of women clear it spontaneously. However, in some women, the infection persists, and this is the at-risk group in which long-term persistence of the virus on the cervix may lead to the development of neoplastic changes. These instruments are very suitable for HPV detection because, in addition to identifying the group of high-risk HPV types, they can also differentiate the most high-risk types, namely HPV 16, 18, and 45. If these types are detected in a patient's sample, her clinical management should differ from that of a patient with lower-risk HPV types. Here we can see what a result looks like. The majority of patients do not have detectable HPV, which reflects the situation in the population, where the prevalence in women is approximately 10%. In younger women, the virus is more common, while in older women it is less frequent. Here we see two patients who are positive, and we can look at their results in more detail. We can clearly see curves reflecting the course of the PCR reaction. We also see that the sample was collected properly, as the cellularity control is present. At the same time, HPV from Group A was detected, which includes moderately high-risk types. These instruments significantly reduce our workload and, most importantly, minimize the risk of human error, which is absolutely essential when processing a large number of samples, several hundred per day. If rapid processing is required, we are able to deliver a result in approximately 2.5 hours.